So second-line treatment options for patients who haven't gotten better after about 6 months of physical therapy and the stretching programs can include an injection, potentially a shockwave treatment, or we may need to talk about further treatment options like surgery. Surgery is actually rarely needed for treating plantar fasciitis. About 90% of people are going to get better with non-operative options after about 6 to 10 months of treatment. So that leaves about 10% of people, if they can stick it out through the treatment options that we've discussed, that might actually need surgery at some point. So there's a couple of different surgical options for treating plantar fasciitis. The classic approach is to make an incision on the inside part of the heel to expose the plantar fascia and to remove just a part of that, and also release the nerve that's being pinched. The second and newer treatment option for surgically correcting plantar fasciitis is to make a small incision just over the heel and then use an ultrasound machine to further visualize the plantar fascia, and then use a small device that's inserted through that incision to remove the diseased part of the plantar fascia. Recovery for the traditional surgical procedure for treating plantar fasciitis is that you'll be using a splint for a couple of weeks and probably going to be on crutches for those 2 weeks, and then we'll transition you to a boot and allow you to walk with the boot for another couple of weeks, and then transition into regular shoes as your symptoms allow after that. Recovery from the minimally invasive procedure requires a couple of days using crutches in the boot until your symptoms allow you to start walking on it, and that's usually after about 2 or 3 days. We'll usually use the boot for a couple of weeks, and then folks can start using their regular shoe wear after that. Most patients will be able to get back to their normal activities. About 25% of people will have a reduction in their overall activities, or perhaps the intensity that they are working at, but most people will get back to their regular activities, yeah.